In this video, we will be learning about the mouth-body connection and the importance of good oral health. Many people do not realize how their oral health affects the rest of their overall general health. You stand a really good chance of protecting your well-being by learning more about oral health and the connection it has to the health of your entire body, including your brain. The health of your teeth and gums offers clues into your overall health. So it's pretty important to protect yourself and your children by taking time to learn about this mouth-body connection. The mouth is a breeding ground of bacteria, and most of them are fairly harmless. Daily oral hygiene can keep bacteria under control, but with a lazy approach to oral hygiene, bacteria can gain ground and cause oral infections, including tooth decay and gum disease. The connection between oral disease and other diseases. You will find quite a few posts on our site that document various studies that link oral disease with other diseases that affect other parts of the body and the brain. Your oral health is so important to us that we thought it would be a good idea to point out some of the conditions that could be linked to what is going on in your mouth. Here is a list that was recently compiled by a staff member of the Mayo Clinic. These conditions include endocarditis. Endocarditis is an infection of the inner lining of your heart. Endocarditis typically occurs when bacteria or other germs from another part of your body, such as your mouth, spread through your bloodstream and attach to damaged areas in your heart. Cardiovascular disease. Some research suggests that heart disease, clogged arteries, and stroke might be linked to the inflammation and infections that oral bacteria can cause. Pregnancy and birth. Periodontist has been linked to premature birth and low birth weight. Diabetes. Diabetes reduces the body's resistance to infection, putting the gums at risk. Gum disease appears to be more frequent and severe among people who have diabetes. Research shows that people who have gum disease have a harder time controlling their blood sugar levels, and that regular periodontal care can improve diabetes control. HIV, also known as AIDS. Oral problems such as painful mucosal lesions are common in people who have HIV. Osteoporosis. Osteoporosis, which causes bones to become weak and brittle, might be linked with periodontal bone loss and tooth loss. Drugs that are used to treat osteoporosis carry a small risk of damage to the bones of the jaw. Alzheimer's disease. Worsening oral health is seen as Alzheimer's disease progresses. Other conditions that might be linked to oral health include eating disorders, rheumatoid arthritis, head and neck cancers, Sjogren syndrome, which is an immune system disorder that causes dry mouth. Please share with us any changes you may have in your overall health, especially if you have had any recent illness or if you have a chronic condition such as diabetes. Also, make sure that we are aware of medications that you may be taking. How medications can affect your overall health. Our body produces saliva that washes food away and also serves to neutralize acids that are created by the bacteria in your mouth. Saliva is a protection mechanism against microbial invasion that leads to disease. Certain medications are responsible for a reduced saliva flow and should be carefully considered when trying to avoid oral disease. These medications include decongestants, antihistamines, painkillers, diuretics, and antidepressants. If you must take these medications, moderation is highly recommended. Prevent illness. Protect your oral health. Practice good oral health every day and never let it go. Brush at least 2 times a day and never go to bed without brushing. Use a fluoride toothpaste. Floss your teeth, and if you do have bridges, get in under them with the super floss. A healthy diet is essential to your overall well-being, so choose your food wisely. Limit in-between snacks. Replace your toothbrush at least every 3 months. Replace your toothbrush after a cold or flu. Avoid tobacco use. Take time for regular checkups in our office. Also, remember to get in touch with us as soon as any dental issues arise. By staying on top of your oral care, you are making an investment in the future of your health. We are Susan Weinberg and Associates, DMD. We look forward to serving you and your family with all of your dental needs. We can be reached at 503-968-1696, and we are located in Tigard, Oregon. We look forward to seeing you in our office soon.